You're watching CBS 12 News this morning.
January is National Cervical Cancer Awareness Month, and health experts in our area are stressing just how important it is for women to protect themselves against it.
Yeah, cervical cancer is the fourth most common cancer in the world, but it's also one of the most highly preventable and treatable. We got Dr. Thomas Morrissey joining us now. He's the Director of Gynecologic Oncology at the Lynn Cancer Institute. He's giving us some more insight into cervical cancer care.
Dr. Morrissey, thanks so much for being here with us this morning.
Great, thanks for having me.
So tell us, just how common is cervical cancer and what can women do to protect themselves?
Right, so as you said, cervical cancer is the fourth most common cancer in the world. There's about 10,000 cases of cervical cancer in the United States per year, but it's one of the most preventable and treatable cancers with routine screening and also prevention with the HPV vaccine.
So, why do we think, if there's so many cases, if it is so preventable, how effective is the HPV vaccine?
So the HPV vaccine is very, very effective in terms of reducing the risk of cancer and of severe precancerous changes. We found it to be 99% effective. So it's been around since 2005, and it's recommended for all 11 and 12-year-olds in that age range. And so we're working on trying to increase the proportion of 11 and 12-year-olds who are receiving the vaccine. And in those patients, we've seen that it's decreased the risk of the precancerous changes in the cervical cancer by 99%, both here and in Europe and in other studies that are being reported. So that's very important.
Tell us a little bit about where women can go for help to get a cervical screening or cervical cancer care.
So again, we recommend that as far as pap smear screening, that women between the ages of 21 and 29 get pap smears every 3 years, and that women after age 30 up to about age 65 get a pap smear and an HPV test every 5 years. If the HPV test is not available, then just a pap smear can be done every 3 years is the most up-to-date screening recommendations. And if cancer is caught early, it's a very, very treatable thing with over 90% cure rate if we catch it early. In terms of getting help with screening for patients who need help, the Promise Fund of Florida helps provide cervical screenings and cervical cancer care for uninsured and underserved women through subsidized partnerships with local healthcare providers like Baptist Health South Florida and Lynn Cancer Institute. If patients need help, they can go to promisefundofflorida.org and they will get help there.
Dr. Morrissey, I do want to ask you this too. Since the pandemic has began, we've been reporting a lot about how people have been, less apt to get their preventable care, going to see specialists because they're just trying to avoid medical buildings as a whole. Is that what you're seeing as well?
Yeah, we're starting to see that a little bit, and it's been reported in different countries that, especially with colon cancer and some breast cancers, that they're seeing patients are presenting later because they put off the screening. We are seeing this a little bit with the pap smear screening being put off, but hopefully as things get back to a little bit towards normal and that people can get more up to date with all their screening tests, again, mammograms and colonoscopies and pap smears.
Yeah, so important not to put those off. This is a lot of important and helpful information. Thank you so much for joining us this morning, Dr. Morrissey.
Great. Thanks for having me.
Good talking to you.